high blood pressure is a toxic risk factor for stroke, dementia, brain ageing and premature death. Let's assume you haven't had a stroke or a heart attack, but just have raised blood pressure. If lifestyle measures like weight loss, salt control, alcohol reduction and moderately intense exercise for at least 150 minutes a week aren't enough and medications are needed, the question then is, how low do you go? A healthy blood pressure, where the top number is 120 or less. The top number is what's called the systolic blood pressure. It's the pressure when your heart beats and squeezes out a pulse of blood. If it's high, it batters the arteries around your body, especially in the neck and brain. So you'd think it makes sense to aim to get the blood pressure as near normal as possible, that 120 mark. But some doctors are nervous about that, feeling that in someone who's adapted to high blood pressure, such aggressive treatment might lower the blood supply to the brain and ironically perhaps cause a stroke. That's what a group of US researchers tested in a trial called SPRINT, which compared people with standard blood pressure control, where the physicians accepted a level of 140, to a more intensively treated group, where the aim was 120 or less. The study did MRI scans to look at cerebral blood flow, CBF, and got a surprise. Dr. Sudipto Dalui was the lead author.
Thanks for having me.
So what did you find?
We measured CBF at the beginning of the study and after 4 years of following up in both treatment arms. What we found is quite interesting. Contrary to the expectation and concern of many clinicians, the intensive treatment actually resulted in a small increase of CBF after 4 years compared to the standard treatment. Note that although the CBF changes were small, this effect can improve brain health and protect against cognitive decline.
CBF being cerebral blood flow, have you got any idea why it actually counterintuitively went up?
The mechanistic basis actually remains uncertain, but the results suggest that the relationship between blood pressure and CBF is far more complex than a simple relationship between pressure and flow.
You alluded to it, but if this is right, and reducing blood pressure down to what is actually a normal blood pressure rather than a compromised blood pressure, which is actually a bit high, what would be the implications for brain health?
The study will give clinicians more confidence in implementing a strategy of more drastic blood pressure reduction. However, note that this is not a one-size-fits-all strategy. In other words, cerebral perfusion is not the only endpoint of a treatment strategy. For example, the intensive blood pressure treatment resulted in a greater incidence of acute kidney injury. There were slightly higher incidence of falls in orthostatic hypotension in the intensive treatment group.
So there were some people got low blood pressure when they stood up.
So clinicians need to take into account the complete health status before implementing an intensive blood pressure lowering strategy.
So coming back to the implication though for the brain, which some people might be willing to accept in return for some other side effects, would you expect the risk of stroke to drop, the risk of dementia to drop if this effect persisted?
The CBF changes were small, but it was higher than the standard treatment. And this effect can actually improve brain health and protect against subsequent cognitive decline. CBF has been shown to be associated with future occurrence of dementia and other cognitive decline. So this is important.
So bottom line is that for doctors treating people with blood pressure, they can, if they accept the person as a whole and look at their total risk profile, they don't need to be worried about the brain so much. In fact, there may be some benefit.
Previously, it was shown that the intensive treatment showed lower progression of white matter lesions as well, which is a structural correlate of ischemia.
The white matter in the brain is really the nerves, the cabling of the brain, and you were getting less damage with that.
Yes, there are the white patches that appears, as people are aging. Of course, white matter lesions are increasing with time, but there is a lower progression of white matter lesions in the intensive treatment arm. But on the other hand, there was a slight decrease of brain volume. So we have increase in CBF, we have lower progression of white matter lesions, and those are on the positive side. But on the negative side, there was a slight decrease of brain volume. So research still needs to be done, why there is this slight decrease. It went in the other direction.
So what's the bottom line?
So the bottom line is clinicians should be more confident in implementing a strategy, but at the same time, they should carefully monitor their patients based on their risk profile.
And the message for consumers who've got high blood pressure?
The consumer should be more comfortable in having their clinicians trying a more aggressive blood pressure reduction strategy as long as they don't have symptoms of hypotension or they don't have kidney problems.
Good. Look, thank you very much indeed.
Thanks for having me.
Dr. Sudipta Dalui is in the Department of Radiology at the University of Pennsylvania, Philadelphia.